On a Saturday morning, our patient Yannique wakes up with intense pain in the iliac region. Yannique calls her sister in distress, begging her to take her to the emergency room. Her sister quickly heads over to pick her up and heads to the nearest hospital, Coral Springs Hospital. Upon entering the hospital, the triage nurses quickly assess Yannique and assign her to room 13. As Yannique and her sister Lauren enter room 13, they notice it was very clean and new sheets were just placed on the bed. The nurse notices that Yannique was shivering and was able to get her a clean, warm blanket. Yannique uses the restroom several times with the help of Nurse Angie, and Yannique noticed it was clean and stocked with supplies to make sure she had everything she needed. After further testing, it's confirmed that the patient has stage 2 ovarian cancer. The triage nurse Angelica assesses, educates, supports, and provides care for the patient, making sure the environment is one of compassion, empathy, and care.
Good afternoon. My name is Angie, and I'm going to be your nurse today. Can you confirm your name for me, please?
Yannique Burford.
Hi, Yannique. Nice to meet you. I see you have a family member here with you. What is your name and relationship to Yannique?
Hi, my name is Lauren, and I'm Yannique's sister, and I live with her.
Nice to meet you both. I'm going to ask a few personal questions, so I just want to make sure with you that it's okay to have your sister in the room.
Yes, that's fine by me.
Okay, so what brings you in today?
I've been having pains in my stomach and I get full quickly when I'm eating a meal. Overall, I'm just not feeling that well.
I'm so sorry to hear that. Let's see what we can do to make you feel better. When did the pain in your abdomen begin?
It's been on and off for the past few months, but it's become more persistent in the last month or so.
I've also noticed that she's been having more fatigue and that she's using the bathroom a lot more lately.
Okay, so I'm going to take your vitals now and your blood pressure. On a scale of 1 to 10, with 10 being the highest, how would you rate your pain right now?
Like an 8.
Can you point to me where in the abdomen is your pain? And how long does the pain usually last?
It comes and goes throughout the day, but I have it most of the time.
And can you describe the pain to me? Is it sharp? Is it dull? How exactly is your pain?
Um, it's sharp. I would say it's uncomfortable. It feels like bloating.
And is there anything that makes the pain feel worse? Any actions that you do or any foods that you're eating?
Well, when I eat, I get full and bloated extremely quickly. It makes me barely want to eat.
So, because of these changes, you're telling me you barely want to eat. Have you noticed any weight changes, any weight loss?
Actually, yes, I've lost about 10 pounds in the last month.
Okay, so I'm going to record that in our chart to make sure that our doctor takes note of that. Have you been taking anything to relieve the pain?
I've been taking Tylenol every day.
Can you tell me how many milligrams and how many times a day you're taking it?
I take two 500 milligram pills normally, just in the morning after I eat breakfast.
Okay, and when was your last menstrual period?
Hmm, I actually can't remember. Now that I think of it, I haven't been really regular lately. I've been irregular actually.
Can you tell me when the irregularity began? Do you remember the last time more or less
Mm,
months ago?
I've always been regular up to maybe 3 or 4 months ago, but I'm not exactly sure.
And when you do have your period, so is it light, heavy flow, normal?
I normally have regular flows, but my last two periods have been extremely heavy and with painful cramping in the area where I feel pain right now.
Okay, so when was the last time you saw your gynecologist?
I haven't gone in the last 2 years.
Okay, well, it's very important that you go every year and get the routine blood work and pap smear done just to make sure everything is all right.
I keep telling her that, but she doesn't listen to me. She says she just never has the time.
Okay, I guess I'll make an appointment and make sure I keep track of it.
That's definitely important. Do you remember if you had any concerns or abnormal test results the last time you did go to the gynecologist?
Not that I'm aware of, not that I remember.
Alrighty, so I'm going to go ahead and let the doctor know of your concerns and all the information you just gave me so that we can run the appropriate test and we can find out what's going on. I'm going to request an ultrasound of your ovaries since you're telling me that you haven't gotten a menstrual period in a while, as well as lab work. And we are going to keep you overnight for observation just to see if the pain goes down with the medications we're going to give for you.
Okay, sounds good. Thank you very much.
After the doctor, Dr. Brown meets with Yannique. Nurse Angelica comes back to give Yannique a dinner menu and lets her know what foods would be gentle on her stomach. Her sister decides to leave for the night but will return the next morning. Nurse Angelica makes sure the call button is beside Yannique on her bed in case she needs assistance to the room or anything else. Nurse Angelica also provides a remote control for Yannique to control the TV as well as places the tray for her food at arm's reach. Yannique requests Nurse Angelica to close the curtains for privacy. The following morning, after the doctor shares the results with Yannique and lets her know that her diagnosis is stage 2 ovarian cancer, Nurse Angelica enters to discuss the care plan.
Hi, Yannique. How are you today? How are you feeling?
Not so great. I'm just somewhat glad I got some answers. Do you mind explaining a few things to me? I'm not sure I understand the doctor all that much with all this medical talk.
Of course, I don't mind. I know it can be a lot, especially getting a new diagnosis. What can I clear up for you?
Dr. Brown told me I have stage 2 ovarian cancer. What does that mean?
So, stage 2 ovarian cancer in your case means that the cancer is in one of your fallopian tubes and has spread to the uterus, but it hasn't spread to any distant sites yet. So, it is treatable and there is a very positive prognosis.
So we should be able to have kids?
Well, because your cancer is in one fallopian tube, there still is a chance that you might be able to conceive once you're completely done with treatment. I know Dr. Brown has great fertility specialist colleagues that he can recommend to you when the time comes.
And what can we expect in terms of treatment?
So you'll be receiving 2 different types of drug treatments together. The combination of the drug treatments instead of just one usually has a better outcome for our patients. We will do the treatment through an IV every 3 to 4 weeks.
Will I be able to work? What are the side effects of the treatment? I'm so worried. I won't be able to maintain my house if I don't work.
I can definitely understand how overwhelming this may be for you, and your feelings are definitely valid. With the treatment, you may experience nausea, vomiting, loss of appetite, loss of hair, rashes, and some mouth sores. However, you will be able to work and get through this. I see you have a very strong support system, and that's one of the most important things that you need in order to get through this.
Yeah, I'll definitely be taking care of her. She's all I got.
Is there any way you can maybe give me your personal phone number? You've taken such good care of me. I'd love to repay you back somehow. And just in case I have any more questions.
So, unfortunately, that's not allowed and would cross an ethical boundary between us. But there is a lot of resources and services I can give you information on that will help you both with coping and understanding ovarian cancer and its treatment. I know it can be a lot, and sometimes it's better to be in a support group of people that really understand what you're about to go through.
I understand. Well, then, yes, please. I would love to hear about the services.
So, here's a pamphlet for your an ovarian cancer support group that meets locally in the town once a week. There's also a website on that pamphlet that's for an online group in case you're unable to meet in person. I know a lot of our patients have found a lot of solace in meeting with others, and it's a great way to really understand what it is you're going through and meet others.
Thank you so much. This is going to be hard, and I'm not sure how to handle it. But thank you.
No, there's no need to thank me. I'll be here for you no matter what else you need. We will be seeing you throughout the treatments, and with the support of your family and friends, you are going to get through this. I truly believe it.
Our group's caring theorist is Florence Nightingale. She is known for contributing to the modern nursing practice through her environment theory. Her environment theory focuses on taking care of the patient's environment in order to achieve a positive health outcome. Key points of her theory are that nurses should alter the patient's environment in order to affect change in their health. The environmental factors that affect health, according to Nightingale, are fresh air, pure water, sufficient food supplies, efficient drainage, cleanliness of the patient and environment, and light, particularly direct sunlight. Florence Nightingale's environmental theory also goes hand in hand with the nursing meta-paradigm. The meta-paradigm has 4 components: person, health, nursing, and environment. For person, the health outcome depends not only on the patient's social and spiritual needs, as well as their health care and those people around them, such as family members and important relationships. For health, it's the extent of their entire being. Their health also is accessibility to healthcare. For nursing, it's how the nurse applies their knowledge, judgment, and skills when caring for the patient holistically. And environment considers the surroundings of the patient and how it can affect their health. It's not just the physical environment, but mental, cultural, and economic as well.
Florence Nightingale's environment theory plays a fundamental role in Nurse Angelica's care for Yannique. The importance of the environment and its influence on healing and health sets the foundation of Nurse Angelica's holistic care approach. Due to Nurse Angelica tending to several patients, she understands the importance of communicating with her team about promoting a healing environment that will facilitate a positive health outcome for the patient. Her team consists of providers, other registered nurses, nurse aides, janitors, and cafeteria workers, and together they allow for efficient and quality care of Yannique and other patients. The team works together to not only provide great health care, but that the rooms and bathrooms are kept clean and fully stocked, food and beverages are served and discarded in a timely manner, and that the room is well lit and ventilated. Our scenario also showcases the meta-paradigm's components. For the person component, the nurse takes into account Yannique's sister, Lauren, when discussing Yannique's health concerns. When Yannique's sister bought dessert and flowers to uplift her spirits, Nurse Angelica kindly placed the leftover dessert in the refrigerator and placed flowers by the window to get proper sunlight. For the health component, Nurse Angelica discusses with Yannique the importance of wellness visits and her accessibility to support groups that will aid her with the psychological healing process behind her diagnosis. For the nursing component, Nurse Angelica applies her knowledge, judgment, and skills when caring for Yannique, and shows this when she recommends an ultrasound. Her intuition was correct, as Yannique had stage 2 ovarian cancer. Furthermore, by explaining to Yannique her diagnosis and treatment, Angelica is exhibiting knowledge of the illness and its implications. All of these actions are purposeful and embody Nightingale theory on environment and its impact on health and healing.
After meeting with Dr. Brown, Yannique was left confused with a number of unanswered questions about her diagnosis. Nurse Angelica showcased the empirical way of knowing through explaining in layman terms the diagnosis and treatment she'd be receiving. Nurse Angelica also took the time to explain the care plan, the possible side effects of treatment, and how it may affect her fertility. This brought clarity to Yannique and her sister, which fostered a trusting relationship between the nurse and patient. Nurse Angelica showed that she was knowledgeable about ovarian cancer while also showing empathy towards Yannique's situation. The ethical way of knowing was called forth when Nurse Angelica had to make a choice regarding what's morally right versus wrong. Yannique, the patient, felt trust and a strong sense of security with Nurse Angelica, so much that she requested the nurse's personal phone number under the intention of getting 24-hour care and building a relationship with her. Nurse Angelica made certain to refuse this request and remind Yannique of the patient-nurse boundaries that must be respected, while also providing resources and appropriate support options to provide the comfort Yannique needed to get through her newfound diagnosis and treatments. Both of the empirical and ethical ways of knowing examples shown in our scenario play an integral role in the patient's healing process. The application of the ways of knowing allow for the nurse to treat Yannique as a holistic being, one who needs information about her illness to heal, while also maintaining the necessary ethical boundaries.
Our 2 calls for nursing were shown first through Nurse Angelica listening to Yannique's needs and concerns in the initial assessment by taking vitals and providing a comfortable environment. The second call for nursing was explaining to Yannique the importance of annual wellness visits to the gynecologist and educating her on her diagnosis while comforting her regarding her possible infertility and providing resources to get her the moral support that she needs.